Welcome to Healthcare Communication, an organizational innovation pitch. We are a skilled team of graduate students with a variety of backgrounds in research and healthcare, and we have chosen to focus on the communication problem the tobacco treatment clinic at Johns Hopkins Bayview Hospital is facing in order to help them better serve their patients. The tobacco treatment clinic was established at Johns Hopkins Bayview Hospital in 2018. It was spearheaded by Dr. Panagis Galiatsatos, who had a unique vision for the long-term management of nicotine addiction. Dr. G and his clinic are unique in their approach. They aim to treat tobacco dependence with a focus on developing individualized treatment strategies and personalizing communication and connectivity. The patients Dr. G and his team work with are largely reflective of Baltimore City. Many are of lower socioeconomic status, older, and are chronic lifelong smokers. To foster the interpersonal relationships between the healthcare staff and the patients and keep communication as simple as possible, the clinic team connects with patients via text messages. When we approached Dr. G, he asked us to help develop a more efficient means of communication. The clinic began with only a few patients, and in the past 3 years, it has grown to over 200 patients in its care. As the clinic continues to expand, it is becoming more and more difficult to maintain consistent patient outreach. The burden of hundreds of time-consuming, manually sent messages limits the ability to maintain the interpersonal connections that are critical to the clinic's success. These check-ins are a powerful part of the clinic's care that cannot be lost. The communication needs to be more efficient and able to scale up with the clinic's growth. To better understand the problem, we interviewed a handful of people involved with the clinic, including Dr. G, the clinic director, Aaron Simmons, the clinic social worker, Mope, the clinic coordinator, and Miss Stacy, a patient at the clinic. These interviews gave us insight to the processes of clinic operations, the nature of the communication problem, and the patient impact. Some of our team members were also able to join Dr. G in the clinic to observe, and we gained valuable knowledge from on-site observations. We also had the privilege of interviewing Dr. Frank Leone, who is a mentor to Dr. G. Dr. Leone opened a similar tobacco cessation clinic at the University of Pennsylvania in the 90s. He emphasized the therapeutic quality of the interpersonal connection between tobacco cessation patients and their physician or healthcare provider. To solve the clinic's communication problem, we brainstormed potential solutions, such as a group of volunteer medical students to help with text messaging responsibilities. Another possibility was using the MyChart communication system, since it is already used throughout Johns Hopkins Hospital. Finally, we came up with the idea of purchasing an automated mass text messaging system to streamline communication. We presented these potential solutions to Dr. G to see what he thought would work best. It became very clear after speaking with him that there were three criteria the solution had to meet. First, the system must maintain the simplicity of text from the patient side. Second, we must avoid MyChart for automated messaging due to already pre-existing known patient resistance to the system. And finally, the system must distribute and streamline the load of manual outreach per patient. Our team presents the following communication system to meet the needs of the tobacco treatment clinic. TextMagic is an all-in-one bulk SMS service that we believe reflects the clinic's core values of maintaining accessibility for patients and supporting the personal relationship between patients and clinic staff. The clinic staff will see a reduced load in manual outreach and will be able to distribute the communication across its internal system. The system can continue to be used as patient numbers increase and additional clinics are established as it accommodates scalable growth. Our team recommends the implementation of the TextMagic system by the clinic to determine whether it is a successful option. Testing can occur on a subgroup of patients and expand based on positive feedback. This will allow the system to be tested to determine its day-to-day benefits and limitations. Then a decision can be made about whether the system should be implemented or if an alternative solution will need to be used. Additionally, our team is able to help with implementation once the decision has been made by the clinic. We understand that the tobacco treatment clinic faces a big communication problem and needs to establish efficiency before additional clinics are opened. We ask that the clinic utilizes some of its grant money to test run the TextMagic system in order to determine its feasibility as a solution. We would like to thank Dr. G for allowing us to collaborate with him and his team and for opening up his clinic to us. We would also like to thank Aaron, Mope, and Miss Stacy for their willingness to speak with us and give us feedback.